The coronavirus pandemic is affecting all areas of the medical care system, and one area where it's becoming really apparent is in organ transplants and donations. From things like not being able to fly organs on commercial or private airplanes, or people not wanting to go into hospitals because they're worried about getting sick, so people aren't donating organs and people are having to wait on wait lists for a lot longer. Today I talked with Dr. David Axelrod about some of these issues and what patients who are waiting on waitlists for organs should know.
I think one of the most important things to recognize is that one of the major sources of organs, particularly for kidney transplant, is living donors. And all of us have been very concerned that we don't put living donors at risk by bringing them into the hospital. That, of course, means that the recipients are going to wait for a longer period of time. So around the country, about 90% of transplant from living donors have stopped. Those that have continued have done so sort of in extreme circumstances.
If somebody is waiting on a kidney transplant and they've been waiting for a while, how long can they wait for? Are they in immediate danger if they can't get a transplant in the next couple of weeks or months?
So the overall chance of dying on the kidney waiting list is about 1 in 20 per year. For folks who have type 1 diabetes, it can be as high as 1 in 5 per year. For relatively otherwise healthy people, it may be less than that. So we sort of usually think about a 6 to 7% mortality per year every year you wait. So if we delay transplants for 3 to 4 months, you expect maybe 1 to 2% of the people to die on the waiting list, waiting for those organs. Unfortunately, in this country, it really depends on where you live, but we have waiting times in New York and in California of 7, 8, 9 years. So we already know that people are dying on the waiting list and they're dying every day.
Just back to basics for a minute. What are some of the conditions that require people to get an organ transplant?
Lung diseases can be everything from cystic fibrosis, which is a disease that we're born with, to COPD and bad diseases where it's acquired in the lifetime. The most common kind of transplant is still a kidney transplant. The major causes of kidney disease that lead to failure are still high blood pressure, diabetes. And so what we see is the new cause of end-stage liver disease that we're going to transplant. It's actually the obesity epidemic. So the obesity puts fat in the liver just like alcohol. And so patients who are chronically obese for a long period of time develop cirrhosis in the same way.
When I think of organ transplants, one of the things that pops into mind is that stereotypical scene where they're putting an organ in a cooler and putting it on a plane and flying it across the country. How often does that happen, and has the decrease in commercial flights impacted that?
I was talking to colleagues in New York a couple weeks ago. They had a person who was on the list to get a heart transplant, had an organ for him, had a patient for him, and there was literally no private planes that they could lay their hands on because everybody was fleeing COVID. For kidney transplants, we routinely ship them on commercial aircraft, and that's had a substantial effect of the COVID. As the travel industry has contracted, our ability to transplant those organs has been diminished, because if we can't get that organ here in a reasonable period of time, we obviously can't put it in. We've been hoping to work around those sorts of things. There are ways of preserving organs a bit longer and that sort of stuff. But it's highlighted for the whole transplant community a need to innovate the way we deliver those organs.